Earlier today, it was announced that Dr. Martin Salia, a surgeon from Sierra Leone who was brought to the United States after contracting Ebola, has died. The medical facility in Nebraska said he arrived in the very advanced stages of the virus and nothing could be done to save his life. Complicating matters, Salia first tested negative for Ebola and then a second test proved positive. For more, I spoke a short time ago with Dr. Gavin Macgregor-Skinner, an infectious disease expert. Gavin, Dr. Salia was 13 days into his illness when he arrived here in the US. Just how advanced was the Ebola virus by then?
Extremely advanced, and what Ebola virus disease does to the body, it liquefies the internal organs. And so we know that when he arrived on the Saturday, he had kidney failure and respiratory failure. And again, it's very, very difficult to treat and to save the lives of those patients.
Can you explain, though, why he would have initially tested negative for Ebola and then subsequently tested positive? Does that seem strange to you?
It does. It does exactly seem a little unusual, and it raises many questions that we need to now answer. The test that we do is called polymerase chain reaction, or PCR, and that can detect extraordinarily small amounts of virus in the blood. So you don't become symptomatic until you have Ebola virus in the blood, and then we can detect it. So this test is highly accurate, highly sensitive, and we really need to go back to the laboratory in West Africa, but also the situation there and see why there was a negative.
Dr. Salia was also treated with this experimental drug. Could really anything more have been done to save him?
Well, this is unusual in that we had been hearing here in the US that there was no more ZMapp available. And then suddenly we heard on Saturday evening that Dr. Salia was being treated with ZMapp, and then he also received convalescent plasma, which is the best we can do at the moment. So again, using ZMapp and these experimental drugs so late in the stages of this disease, we're still learning a lot.
We're hearing from the Red Cross that many doctors and nurses are reluctant to go to West Africa to help in the fight against Ebola. You've been training health workers in Tennessee. What do you tell them about the risks involved?
The risk that we talk about is that it's very difficult to get Ebola. You can only get Ebola if you put it in the eyes, the nose, the mouth, or an open wound. And with the protection and the training, the intense training that we give nurses and doctors, both here in the US and overseas, we know we can protect and create a safe working environment for them. But we have many people that want to go to West Africa at the moment, but we can't get the money for the flights. And that's a real challenge for us.
And also we're seeing a new outbreak in Mali. At the same time as there are reports that in Liberia, Ebola is coming under control. It seems contradictory. What's your assessment of what's going on?
About this whole Ebola event, it's been a lack of information. And we're hearing that the cases are decreasing in the cities in Liberia, but we're hearing cases are increasing in the rural areas or the villages. And again, with the situation in Mali, this is a situation that we need to get more information. We're getting people on the ground now. We've heard of a number of deaths, about a handful of deaths over the last week. It's a really serious situation, and we've got to get more people into West Africa urgently.
Do you think we have some way to go before Ebola has spiked in West Africa?
Oh, very much so. And I heard yesterday there was 111 new cases in Liberia alone. And for me, that's a bad day in the office.
Dr. Gavin Macgregor-Skinner, thank you very much indeed for joining us.
You're welcome.